Hello everyone, my name is Dr. Jacobs. I'm a doctor of physical therapy and I'm the inventor of advanced soft tissue release ASTR specialty. I'm also a cancer survivor and I used to suffer from chronic migraines, headaches, pain and fatigue before I invented ASTR specialty. All right, Stephanie, tell me what's going on with your headache, your head pain.
I've been for about 3 weeks in a lot of pain.
Okay.
That's all on the front of my head, like a rubber band around the back.
Okay.
Lots of pressure in my ears to where I feel like I want to constantly pop them and I can't.
Both of them?
Both ears load up with pressure.
Okay.
And when the pressure gets really intense, it comes down my face. My teeth hurt. My jaw hurts. So eating was uncomfortable during that time.
Eating, okay. So what happened? Did you have any trauma, accidents? What happened 3 weeks ago?
What I think it was is I was starting to have what I felt was a sinus infection, and
Okay.
I flew out of town.
Okay.
And when I flew back, the pressure built up in my ears in the plane, and it seemed to never release.
Okay.
And I don't know if going out of town and taking a couple days off work, I did try to return to work one day after, and it was very stressful. So I
Okay.
might have been very tense at that time as well.
So for the last 3 weeks, what kind of test did you have, and what kind of treatment?
I've been in and out of the ER, and they've done a spinal tap.
Spinal tap, okay.
2 CT scans, one of
Okay.
the head and one of the sinuses, and an MRI with and without contrast.
Okay, and everything was negative?
Everything was
Okay.
negative.
So they did all the tests, and what kind of treatment you had? What did they give you?
At first they thought that the pressure was coming from the sinuses, so they
Okay.
gave me steroids and antibiotics.
Okay.
They switched my antibiotics multiple times
Okay.
before I could actually finish one of them.
Oh, okay.
And then they decided...
But the MRI and the CAT scan, is it showing that you have infection? Or the
No.
blood work showing any infection?
Well, once they had done that even prior to doing any blood
okay.
work.
Right.
And then once they did the blood work and the CAT scan, they told me to stop the antibiotics.
Because you don't have infection.
Right.
Okay.
And they first round gave me Imitrex and Flexerol. I took that and it didn't help. And during this time, I was unable to sleep.
Oh.
So I was hoping the Flexerol would make me tired. It did not. And they would give me in the hospital morphine and Dilaudid, and it wouldn't work. And then they finally decided to give me a drug called Topamax that was supposed to relieve the migraine and prevent future migraines. It had horrible side effects for me. My body started to get tingly and numb in certain places. And I was aggressive and agitated and very sleepless. I was not comfortable, so I could not rest.
Are you taking that now or still?
No, I stopped taking that. When I stopped taking that, they then decided to give me beta blockers.
Okay.
And I started taking that for a few days, and it was lowering my blood pressure, so it was making me feel weak and lightheaded, and it didn't seem to help at all, so I ceased at that.
So you tried everything?
Yes.
Okay, sorry about that. Any other treatment?
I then went to an acupuncturist, and she kept putting the needles in and asking if I had relief of pressure or pain, and I never did.
And that's why you have those little bit bruises?
Yeah,
there.
I have bruises here, and then also on my stomach.
Oh, wow. Okay. So how much pain and headache you feel right now from 0 to 10?
So I did take a sleeping pill last night, and I finally got, I think, about 4 hours of rest, maybe 5. And so I woke up this morning and I was moving around and I felt a little bit better. So right now I'm about a 5 or a 6 of pain.
Is 5 and 6 constant or comes and goes?
It's when I'm at my least amount of pain, it's a 5 or a 6.
Okay. At worst, how much?
8 or a 9.
8 or 9.
So
Can you just tell me now the pain? Where do you feel it? The pressure and the pain?
My ears feel plugged up.
Okay.
There's a lot of pressure in my ears, down here in my jaw.
Okay.
My teeth, the top teeth a little bit.
Okay.
And then behind my eyes and around the back of my head.
And that's 5 and 6 now.
Correct.
Okay. Make sure everything is pain-free.
Okay.
Right. So I will have you lie on your back.
Okay.
Right. Okay, so you feel it like a band here. Okay. Is that too much?
No.
Okay. So that's really fascia restrictions. I can release it. Should move like this. So you said you had a trauma here before? In your eye?
On my eye, yes, my
Okay,
right eye.
what happened?
I was headbutted playing soccer, and it split my eye open.
Mm. When did that happen?
About 4 years ago, maybe.
4 years ago?
Yeah, maybe close to 5.
Yeah, so you had sutures there?
Yes, three
Okay.
stitches.
Sure, this is not too much. And you said that's another band in the back here, yeah?
Yes.
Okay, right in here.
Yes,
Oh,
that's
you
the
have a lot of scar tissue, you feel that?
I thought I
this
could
one?
feel it, yes.
Yeah, that's a lot of scar tissue here. Yeah. And that's where you feel the band?
The most pain, yes.
Okay. Do you feel pain from what I'm doing?
Yes. I mean, it's
Well,
pretty sensitive.
if your pain level is the same,
Mm-hmm.
that's fine. If your pain level increases from what I'm doing, make sure you let me know.
Okay.
Okay? Did you feel nauseous, dizzy, or vomiting during this time?
I got nauseous periodically. I never actually vomited,
Mm-hmm.
but I would get dizzy, and it would be like foggy,
Mm-hmm.
blurred vision.
Okay. Do you have that today?
No.
Okay. Is that when you start to go to the ER? You have the
Yes.
symptoms? Yeah. Blurred vision. Okay. Is that too much what I'm doing?
No.
Okay, I'm gonna work a little bit on the scar tissue. Make sure it's not painful, okay?
Okay.
Do you feel this bump here?
Yes.
It's a scar tissue. Everything here. So you clench your teeth?
I grind
You
and
grind your
clench.
teeth. Okay, can you give me a little bit history about that?
I've been doing that for probably 10 plus years,
Mm-hmm.
and I went to a new dentist about 8 years ago, and he pointed it out and told me I needed to definitely wear a mouth guard at night.
Mm-hmm.
So I'm on my 3rd mouth guard because I usually grind so much I break them.
Wow, okay. And that's why you have those teeth sensitivity from a lot of clenching at night.
Yes,
Do
probably.
you hear her at night?
Sometimes.
Mhm.
Sometimes.
Yeah.
Try to move her a little bit, you know, so she.
So if her head is twisted, she start to clench more, grind
I think
more?
so, yeah. I think when she's, because she sleeps on her side a lot, so I think when
Okay.
she's grinding it.
Side or the front? Let's look like a front.
When she sleeps like this, side. But she grabs a pillow and sleeps this way.
Is your stomach touching the table, the bed?
Sometimes, yes.
That's sleeping on the stomach.
Oh, really?
That is, if your stomach touching like this,
Mm-hmm.
yeah.
Oh, okay.
It's like sleeping on the stomach but twisted a little bit, not
Right,
touching
right.
the stomach. Because if you sleeping on a stomach like this, how are you gonna breathe?
Right,
I
right.
hope not. You know. So yeah. So we need to change that. Okay.
How do I sleep?
Well, for jaw pain, the best position is the back. You know, if you can sleep on your back, that is the best position. How to do that? Okay. Every time she sleeps on her stomach, wake her up.
Okay.
So you're gonna be awake all night long.
Right, right.
That's not the solution, okay? Don't do that at home,
Yeah.
okay? Get a tennis ball, put it in a sock, tie it in the stomach. As soon as I see sleep on your stomach, that will wake you up, so you're gonna turn. But you need to do that for 2-3 weeks,
Okay.
okay? So, and the same thing for the side, you know, if you wanna stop avoid inside sleeping, I will tie it on the side. So when she sleeps on that side, that will wake her up.
Right.
But you have to do it for 3 weeks.
Okay.
Okay? So for your condition, I want you to sleep on your back.
Okay.
Because the grinding there.
Mhm.
Okay? Hopefully that will drop your jaw and you avoid too much clenching, grinding. Is that too much?
It's okay.
Okay. You feel it, yeah.
Mhm.
So, did you have any hits in the nose area?
Yes.
What's happened?
I had when I was a kid. I was hit with a wagon handle between the eyes.
Oh my goodness. You're lucky, by the way.
I know. I'm
Yeah.
glad I hit there and didn't take an eye.
Oh my goodness, that's crazy. Oh. Did you have any, like, concussion or anything?
They were. I don't think they did any tests for it, but my mom
Mhm.
had to keep me up most of the night just to make
Mhm.
sure.
Do you wear contact?
I had LASIK. I used
Okay,
to.
Nice. I had LASIK. Okay. Is that too much?
It's okay.
This is- Okay, is it okay to work inside your mouth?
Inside?
Hmm?
Yes.
Okay. Do not bite me, okay?
Okay.
So, thumb up if you feel pain, okay?
Okay.
Alright, open. Close. It's open, I want to see something. Okay. Close. Sorry. Thumb up if you feel pain, okay?
Okay.
Okay.
Yeah.
Okay.
Mhm.
Okay. You have bruises in your hand, your forearm too. Is that
That's
from
the IVs.
acupuncture?
From the IVs.
IVs.
The ER.
Oh wow.
Yeah.
so-
Apparently they're not very good.
You
at that.
bruise very easily, is she?
Well,
Not
or-
typically.
No.
Man,
They had a lot of trouble finding
finding her.
a vein. Apparently she has small veins.
Yeah. Yeah. So you see bruises here. Is that too much?
It's okay. Oh.
Oh, okay. Okay, don't bite me. Okay. Is that too much?
It's okay.
Too much. Okay.
Must be pretty tight.
Oh. Mm. Yeah, we have some work to do here. So actually, it's not as bad as I thought. Actually, so her tightness all closer to here, really closer to her ear.
Right.
Most of her
Yeah.
tightness there. She feel the ear pressure.
Mhm.
It's common with TMJ. So what we have here, TMJ slash tension headache slash migraine.
Right.
So we're gonna work on all of that. Is that here?
No.
Okay.
Oh.
Oh, sorry. Okay. See, she's still awake. Okay. Alright, so. Okay. Alright. Okay, it's gonna feel cold. Alright. I'm not gonna work on the area you had bruise here.
Okay.
I'm gonna work away from it. Okay. Okay. You feel this bump here?
Mhm.
You see the tool.
Mm-hmm.
It's just a stuck, like
Yeah.
not very smooth. Is it too much?
It's okay.
Yeah, she has a little bit now. You feel the scar tissue here.
Mhm.
You see that?
Yeah.
See? And you see, it's not like going like this. And jumping. That's where she has the scar tissue. Do you want to feel it?
No, I'll let you do your thing.
Yeah, okay. Some patients, some like have family member like to feel,
Oh, yeah.
you know.
Some other time maybe.
Yeah.
How did you come up with this?
Well, it's a start with my wife used to have TMJ pain. She had it for over 3 years, and I tried with her everything, and she experienced like pain relief 1 to 2 days, nothing lasts, you know, everything I learned in school. I took a specialty classes, bought a lot of books, nothing will provide long term. So one day she walked up with a lockjaw. She was not able to talk or eat, and she asked me to try anything, and I told her I tried everything. So I reached my hand inside her mouth and I started to experiment. After a few minutes she was pain-free and her jaw was unlocked.
Oh, wow.
So it took me several weeks after that to understand the concept that I used on her. And after that, I developed over 125 maneuvers to implement the same concept to treat the entire body. During that time, you know, I'm a cancer survivor, so I used to suffer from chronic migraines and headaches, fatigue. So I was not really happy with the outcome. So that's what led me to look for solutions. So start with working maneuvers, and then my hand was killing me actually from using my hand so much. And 6 months later, I told my wife I cannot do this long term. So she told me, you know, you came up with maneuvers, come up with tools. So I went to hardware store, get the PVC pipes, cut and shave, and came up with the design.
Wow.
Yeah, but the protocol for fatigue, migraines, and all of that, that's from my personal experience, and I start to study more nutrition, more functional medicine, more treating the source of the problem instead of treating the symptoms.
Right.
And that's how I was able to get rid of my migraine. And it was a protocol, I use it with the patient. So it starts like a technique using one element of the problem, like working on scar tissue or fascia restrictions. But I keep adding more stuff. It's a biopsychosocial model that addresses 11 elements of the problem. So, and based on the study, actually, when implementing the biopsychosocial model and addressing the problem from all aspects, that's when you can get good result. Instead of like going to if you want to have like a car tune-up, okay, you want to go to a mechanic that's changed the air filter and says good luck, you know, I just changed the air filter, the performance is going to improve, but that's not really a good improvement. So that's the problem that I found with a lot of technique. So how we train healthcare provider to change the whole, to do the tune-up, and that's ASTR actually, doing the entire tune-up, the nutrition, the ergonomic, the stress management, the soft tissue, the behavior modification.
That's something I noticed. They always treat the symptoms. They don't really treat the core issue.
Unfortunately, you know, and I personally experienced that, and you know, there's a solution, we have to look for it, you know, or if there's no solution, we have to figure out a solution, you know, figure a solution. But you know, I like to figure out a solution. Is that too much?
No.
Okay, sit up for me and tell me how that feels. Do you have water with you? So give me an update.
Both of my ears are still
Mm-hmm.
plugged, the pressure.
Mm-hmm.
It's slight on the back of my head, not as bad.
Mm-hmm.
And this one's, I can hardly feel right now.
So you still feel in the back. I'm not sure about your ear because I did a test before. Let's have you sit here. For your ear, you have internal inflammation. A couple of tests I did. So it might take us a little while for your ears.
Okay.
So, but now I'm just gonna work on the front and the back.
Okay.
I will work a little bit on the ear, but we need to do more other stuff on it. Okay. So remember the test I did it with her. She could not tolerate it. Sit here. Okay.
Fine.
Let's put this on the side. Okay. So that's a tension headache, the front and the back. So, is it too much here?
No,
But you feel all those like crying.
I do.
You hear that?
Mm-hmm.
She's like having a little, like a grain, you know.
Is that all
Lower.
scar tissue?
Yeah. Well, it should feel like nice and smooth like this. Well, let me see. Ah, feel how nice and smooth here? It's not perfect, but you know, it's a little bit.
I was
Yeah,
feeling his head to see why mine
You
was.
feel how nice and smooth here?
Mm-hmm.
Okay, compare this to this.
Yeah, it's very ripply back there.
Yeah, yeah. So you should not have this. Usually from poor posture, poor body mechanics, or accident, you know, get a micro tear in the soft tissue and your body starts to build a scar tissue. Okay, let's move your hair to the side. Okay.
I'm very tender there.
Sorry.
It's okay.
Let me know if it's too much, okay? Any neck issue?
Just very tight.
Yeah, sometimes right here,
Mm-hmm.
the muscles in her are like
It's like a rock.
a rock.
Muscle spasm. Yeah. Yeah. That's what causes tension headache too.
I've been trying to use those electrodes on it more often.
Yeah. Electric stimulation is temporary pain relief, you know. We need to get to the root of the problem. Okay, let's move this to the relax. You have low back pain?
Yes, down
Is it
here.
okay to work in the back here?
Sure.
Low back or mid back?
Low back.
How long?
Just recent, since I've been kind of trying to rest and.
Yeah, you probably compensate for posture. Okay, let's drink a little bit more water and tell me how does that feel? The front and back of your head.
It's still a little bit in the back of my head.
How
Not as
much
bad.
from 0 to 10?
Probably about a 2 or a 3.
Okay, the front.
In the front, I don't really feel much. When
What about the pressure in the ear? And how much is the pressure in the ear?
This ear is still pretty loaded with pressure, and it's probably about a 6 or a 7 of pressure.
Okay, we'll work on the ear next time. What about the back here? You feel it's just like a band, yeah?
Yeah, it's just, and
Let's
it's,
line your back here. Okay. Tuck your chin. Man, relax. She's very tight.
Mm-hmm.
That's a very tight. Did you try to massage it?
Mm-hmm.
Yeah.
It's like almost to the point where
Yeah,
it's
you
like
cannot.
bone.
Yeah. You cannot. Well, it's hard with the hand.
It doesn't give
Mm-hmm.
at all.
Yeah. Shrug your shoulder.
do what?
Shrug your shoulders. And squeeze your shoulder blades. Squeeze your shoulder blades and relax.
I think that's part of the reason why her headaches are so bad sometimes.
Mhm.
Because
She has a lot of tightness. Well, here's the problem with this. If you have a lot of tightness here, if you do this, actually it can cause headache because that's compressed on the vertebral artery that go into the brain that provide the blood supply to the brain. So if you block the blood supply and the oxygen level to the brain, yeah, it's migraine. And that's overlooked as cause of migraine from scar tissue and tightness here that compressing on the vertebral artery.
Makes sense.
Yeah. So, and how to treat that? Well, you have to mechanically break the scar tissue.
Yeah.
There is no drug gonna break the scar tissue. Okay, sit up for me. Tell me how this feel.
Oh, that feels much better.
Any pain in the back?
It feels just like a dull pain.
Let's drink some more. How much from 0 to 10?
Like a 1 or a 2.
Let's drink some more and tell me how that feels.
Was another reason I was having trouble sleeping on my back.
Because that's area.
Mm-hmm.
Because it's very sore to lie on it. Yeah. How does that feel now?
It's good.
Mm-hmm.
It's just very low, dull
And
pain.
let me see the exact spot. Switch with me. What?
Right here, mostly on these 2 points.
Oh. Yeah, it's the two scar tissue. She has 2 bumps,
Mm-hmm.
left and right.
I told you I had a bump there, honey.
Mm-hmm.
Is that too much?
It's okay.
Okay. Man, how did you do that? You slush a lot?
Yes.
Probably.
Oh, you do. Okay. I'm gonna give you injection. Not really. Okay. Okay. Let's move around and tell me how is your neck feel now. So the tension headache from 0 to 10.
I think that's just a little bit of soreness, probably.
Let's drink
But
more
it-
water. Soreness, that's a lactic acid. Want to make sure you flush it out. You know, if you're not drinking enough water, you're gonna feel soreness from the toxic we just released.
Okay.
That's okay, but that's mean you need to really drink more water to flush it out. But pain-wise and headache, in the back and the front.
Actually, this one right now, I'm feeling a little like 1 or 2.
Mm-hmm.
And then this one, just about a 1. It's still slightly there.
Okay. Okay, now you're back again. Okay, tuck it. Okay. Push my hand in. Push in. Tuck. Relax. Push and relax. So can you tell a difference after the treatment and what do you feel?
I can.
Okay.
The ears still a little pressure here.
We're gonna work on the ear next time, yeah.
But the back of the head, that band, that tightness and that pressure,
Okay.
definitely much, much less.
And the front.
And then the front,
Okay.
yeah.
So what do you think about ASTR treatment?
Obviously, it's working.
All right.
So,
Awesome.
and you can feel all that scar tissue.
You can feel it, yeah.
Mhm.
It's not like,
No.
yeah, it's obvious to see, feel.
It is.
Yeah.
I can feel it.
Yeah, awesome.
Thank you.
All right, you're welcome.
Okay.
Thank you. Feel free to subscribe to my channel to get helpful tips on how to relieve pain. And if you are a healthcare provider and interested to be ASTR certified, you can follow the link below. You will get information on how to register for ASTR online class. There's over 40 studies that support ASTR treatment model, and also there's over 400 studies that utilize by ASTR treatment. And feel free to check over 220 videos that most of them actually real treatment videos. We'll see you soon.